Did you know that you might be able to get reimbursed for some of the money you lay out for a therapist who is not taking insurance? Let's talk about it. But first, an outfit of the day. I'm Elise, therapist for a million years, coach for women, coach for therapists around money mindset. This is a jumpsuit. Yes, it's summery. Yes, these are summery. I don't care. It's just about mid-September, and I'm gonna ride this wave as long as I can. It's sleeveless too, and my office is always cold, so luckily I have a blanket. I thought this was common knowledge, and that's probably just because I'm in this field. And then I was talking to someone who was unaware of this fact, so I wanted to share. So some therapists do not take insurance, or they're not paneled with insurance, which means, let's say I don't take insurance, I don't have a contract with an insurance company, right? So I don't work directly with insurance. However, I have clients who will submit a receipt that I give them to their insurance company. They get reimbursed a portion of the money that they have paid. The way that works is you would need to call your insurance company and ask, what are my out-of-network mental health benefits? And they'll tell you, if you have out-of-network benefits, generally you are subject to a deductible, and that's the amount of money you have to pay out of pocket before insurance kicks in. So let's say, for argument's sake, you have a $1,000 deductible. They might say, once you have met your deductible, we will reimburse you at 70%. So you will get back. They're not going to tell you exactly how much that is, and you won't really know until the first claim gets submitted. But a lot of people are unaware that that is an option that can offset the cost. So if you really want to work with a therapist who doesn't take your insurance or doesn't take any insurance, that could be an option for you. So it's worth a phone call to your insurance company to see, do I have out-of-network benefits, and what are they? Most therapists, I'm going to say, I can't say all, because some might not, but most therapists will provide you. It's called a super bill. It's basically a receipt. The downside, if we go there, the downside is that a therapist is required to give you a diagnosis. The insurance company will not pay for a session without a diagnosis. So that's part of the deal. You will be given a diagnosis. And some people don't like a paper trail of that, or they kind of want to keep therapy private. Like, this is my business. I don't want to involve anyone else, and so they don't submit to their insurance company because they don't want to. That's cool too, whatever it works for you. But it's not so black and white. There is a middle ground here where you may find a therapist that you really want to work with, and like, wow, I didn't know that was an option. Maybe that enables me to make this work financially. If you have any questions about this, feel free to leave them in the comments.